So this will be broadcast, and so
Yeah,
that's great. Yeah, fantastic. I'll just keep on.
So it's broadcasting now, is it?
Just whenever you're ready, I'll let you know.
Yeah, so whenever you're ready.
Yeah. Start the broadcast, please. Good morning to everyone. I am Councillor John Ogle, the Chair of the committee. I would like to welcome you all to this meeting of the Adult Social Care and Public Health Select Committee that is being broadcast live and recorded for publication. Item 1, Committee Membership. To note the membership of the committee for the 2024-25 municipal year as follows. Councillors Ogle, Martin, Adair, Bailey, Carr, Doddy, Fielding, Henshaw, Kerry, Owen and Pringle. Item 2, Chairman and Vice Chairman appointments. To note the appointment at full council on the 16th of May 2024 of myself, Councillor John Ogle as Chairman, and of Councillor David Martin as Vice Chairman of Adult Social Care and Public Health Select Committee for the 2024-25 municipal year. To also note yours and the committee's thanks to Councillor Roger Jackson as the former Chairman of the committee. Item 3, minutes. I'm going to seek your approval. Is it your wish that we accept these minutes as a true and correct record of the last meeting? All those in favour? Thank you. Item 4, apologies for absence.
Chair, I have apologies from Councillor Carey on other county council business with Councillor Roger Jackson substituting.
Thank you very much. Item 5, declarations of interest. If any councillor or officer has an interest in any matter on the agenda, you should declare it now. Please raise your hand now if you have an interest to declare. If you have an interest to declare, you should state what type of interest it is and give brief details. None. I have a duty to remind members that scrutiny is an important non-political process carried out by councillors on behalf of the residents of Nottinghamshire. Do note that this consideration is particularly important during this pre-election period. I remind members that they can ask more than one question, but they should only ask one question at a time. This makes it easier for the Cabinet members and officers to provide answers. Item 6. Progress update on the Nottingham and Nottinghamshire all-age carer strategy. I would like to welcome Pam Hill, who is here to support the presentation as a carer. Thank you. I'd like to welcome Councillor Cllr, who is joining us for this item on behalf of the members of Children and Families Select Committee. I now ask Councillor Jonathan Wheeler, the Cabinet Member for Adult Social Care, to introduce this report.
Thank you, Chairman, and good morning, colleagues. So absolutely delighted to be here with you this morning to be able to talk about the progress we're making on the all-age carer strategy. So I hope members be aware it was March 2023 when the item was taken to Cabinet by Councillor Barney, my predecessor, and I think what's really fantastic about this strategy is it's not just first as the council, it's working together with the ICB and Nottingham City Council to make sure we have a strategy that goes across all our partners to make sure we're all on the absolute same page and doing what we think is right by our carers and our people who are looking after them, most importantly. So today we'll just bring you an update really in terms of where we are so far this year. It's obviously invite questions and feedback from yourselves. I'm going to be handing over to Katie Paul shortly, who'll take you through the presentation. As Chairman said, I'd really like to welcome Pam, who's here this morning, co-chair of our carers group. I think it's really important to have people like Pam here who can actually, with that lived experience, actually really give that first-hand account of what the strategy is actually meaning in practice on the ground, because it's all about all of us having a strategy that we talk about in the committee here or on a piece of paper. It's actually how it's landing with our carers and with our people who we're caring for to make sure it's the right thing for them. So delighted that Pam today, and Sarah from the ICB as well, who's obviously working with us incredibly well to make sure strategy is going forward. And being all age, I think that's really important as well, because we know there's so many young carers throughout Nottinghamshire. It's really important that with this strategy that we are encompassing all age groups as well, because sometimes, unfortunately, in the past, maybe young carers felt like we didn't, they're not getting the same voice as other carers across the whole country. So I think in Nottinghamshire, we've done a really good job in working with them. And obviously, great, Councillor Tracy Taylor's here with us this morning, and we'll be talking about what we're doing to support our young carers, as well as carers for all age groups. So, without further ado, Chairman, I'll bring Katie, if that's okay with yourself. Katie.
Thank you. Good morning, everyone. We are really pleased to bring this item today and to share the progress that we've made in the first year of the strategy. We were going to introduce ourselves, but thank you to Councillor Wheeler, so we'll say a little bit more as we go. So as Councillor Wheeler has stated, we brought our carers strategy through Cabinet in March 2023, and it was put together between the ICB, the County Council and City Council, and the work has been with a much broader range of partners across the public, private and voluntary sector to make sure that we are really raising the profile of carers, the importance of carers, and how as a whole system we support our carers in the best ways that we can. There are some stats in the first few slides, and there's more background information that we've included at the end. So in terms of definitions, just to remind that a carer is someone who helps another person, usually a relative or a friend, in their day-to-day life, which is not the same as someone who provides care professionally or through a voluntary organisation. A young carer is a person under 18 who provides or intends to provide care for another person. And a parent carer is a person aged 18 or over who provides or intends to provide care for a disabled child for whom the person has parental responsibility. And just to remind ourselves of some of the key stats, we know that we've got officially over 82,000 carers in Nottinghamshire, and officially 1,126 of those are 16 or under in terms of age. When we updated some of the information that we have about carers, because we just brought a joint strategic needs analysis through our Health and Wellbeing Board in the last couple of months, we actually saw a slight reduction in the total number of carers, and we know that there are a lot of people that don't recognise themselves as carers, so the number actually will be greater. But what we did see is that the number of carers that are providing over 50 hours of care per week is continuing to increase, and that's really significant for us. In terms of geography, just to mention again that Ashfield and Mansfield actually come second and third in terms of places across England that have the most self-reported carers. And that's really important for us to note. We know that we do have more people living in poorer health statistically in those areas as well. We also have 95.5% of our self-reported carers are white, and when we put the strategy together, we noted at that point that we did have a range of underrepresented voices, and that it would be important in implementation of the strategy to be more deliberate about ensuring that we hear from a broader range of voices and make sure that the support is catering for those voices too. So one of the things that we have done through our Carers Hub is we've got a raft of grant funding to increase that broader access, and we are seeing support to a number of community groups that are doing that, and that will continue to be a focus in year 2. So that's by way of introduction. Just reminding ourselves in terms of what carers consistently tell us, that further support is needed for working carers and parent carers. Short breaks and respite is really critical for resilience and an area that needs to continue to be improved. and that we know that our carers, particularly carers that are providing a lot of hours per week, are facing increasing pressures due to cost of living. So they have been key themes that we have considered during the implementation this year. So before we talk to you about 4 key areas where we've seen a lot of really positive impact, I'd like to hand over to Pam to talk about the co-production of this strategy and how it's actually felt.
Hi, thank you for inviting me here today. My name's Pam Hill. I'm a carer. I've been a carer for over 30 years now. I care for 2 of my children. One has got schizophrenia as an adult, and one who lives with us is now 21. So we've been a parent carer for a number of years. She's got autism and fetal alcohol and ADHD and a number of health problems. So during lockdown, it was really quite difficult for a number of carers, but particularly for ourselves. We'd been left. Our builder had done a runner on us just as we were doing the house up, and we'd been left living in a caravan on a drive. And unfortunately, just as lockdown left, so did he. And following that, obviously school shut, college shut, there was nowhere for her to go. And in desperation, I phoned the council looking for things to do, because we were all climbing the walls in a small touring caravan on our drive. And what I got back after an assessment of our needs was a cheque for £150. And I held it in my hands and I thought, well, that's great, but what am I supposed to do for it? There's no shops open, there's no services open, there's nothing I can do for it. So thank you very much, but it doesn't meet my needs. So what can I do? And as things started to open up, I pursued the council and got involved, and I met a lovely lady called Sarah Craggs, and she introduced me to co-production within the council and said, come on, you obviously want to make a difference, get involved, you've got a voice, use it, what else can you do? And we were just starting the strategy at that point, to develop the strategy. That's about 3.5 years ago now. So come on the panel, use that voice, help us make a difference. So I did. I got involved, and I got more and more involved. I became passionate about co-production because initially I was quite sceptical. I'd been involved with things before, and they'd been about engagement and consultation, and then the councils had gone away and done their own thing. But actually this was really, really different. They had actually listened. They had actually involved us from day one to develop the services that we wanted, not to waste money, not to waste time. And that's what I think is really, really important, because if you involve people in co-production right from the beginning, yes, it's slow, yes, it takes longer, but actually you get a much more efficient service in the end, because you develop the services that carers themselves actually want. It's not a waste of money, because they're services that the community of carers and the community actually want and need, and not what people assume that they need. So it's much more efficient use of budgets as well. So during that time, I became involved in the carers panel, and then working throughout the strategy, I became more and more intrigued with how these services were going to be developed. We put the strategy together, and I was really, really proud of the strategy because it was fully co-produced with carers involved right from the beginning. I became involved then in tendering for those services. We put together the service specifications. We put together the tendering process. I was involved in tendering for those services as well. 3 out of the 4 of the services, 3 of the Nottinghamshire services, I didn't get involved with the city service. That's only recently just gone out, the carers service. And since then I've gone on to the strategy board to oversee the services that we developed and that we'll go on to develop now 5 new areas that the carers panel that I'm still involved with have chosen as their priorities for this year going forward. And I think that's important to note that there was at least 8 or 9 areas that we could have chosen, but it was carers themselves that prioritised which areas should be developed for this coming year, because obviously you can only do so much. So we will oversee the services that we've already done. We will scrutinise those and make sure that they're on track, because I think it's important that the carer strategy is a living document. It's not just a document that sits on somebody's shelf and gets dusty. It has to be at the heart of every service that's developed and every service that's developed going forward. It has to be, as I say, such a living document that we have to, as a strategy board, keep those services on track, keep them there for the carers because that's what they deserve. And we have to keep going to prioritise the needs of all carers of all ages, because this carers strategy was revolutionary. Not only did it take away the postcode lottery by joining with city and county, which had been a huge barrier, it also recognised that parent carers were carers themselves, because originally it had been developed only as an adult carers service strategy. And it was really brave of both councils to recognise that parent carers were carers themselves because of the differences in law. And so it was really revolutionary, and that was evidence of the councillors and the commissioners listening to carers to make this an all-age strategy. So it developed as we were going through the strategy from an adults-only strategy to an all-carers strategy. So that's quite revolutionary, I felt. And that was another way of co-production, how that evolved and how that was a real success story. I think as a board we're still finding our feet and we've still got lots to do. And they're still helping us as carers to, there's still some training for us to be involved, because obviously carers aren't used to working on strategy boards and things like that, and we need some support to do so. But, you know, we are getting help to do that. We've been promised support to do that. But I think it's vital that the board keeps the vision of the strategy right at the heart of developing the services going forward. And that we get the services that carers deserve and need to meet their needs, and that the strategy board is the right place to do that as the oversight for that. Thank you.
Well, I think I'd just say, how can you follow that really? I think that's exactly why we're here today, listen to Pam with her account there. I think it absolutely shows the importance of co-production and why we've got the lead strategy place we have, and why it's really important we continue, as we will do, to listen to people like Pam and other carers to make sure we're doing what's right by them and by our people we're caring for, because that's what we're here to do at the end of the day. And actually hearing the accounts and how we perhaps haven't got it right all the way through, but we're willing to listen and improve and get to where we need to be is exactly what I'm really grateful for, is Pam being on board and showing us that and working with us. So thank you very much to Pam and everyone, all our carers who work with us to help make it better for everyone in Nottinghamshire. Thank you.
Was committed before was so revolutionary. Thank you for explaining all that. So I'd like to ask officers present if there's anything further that you would like to add.
Would it be possible, Chair, to play the story from the young carer that we have ready to go? Because I think that would just provide a broader view of it, if that's okay. If there's still time for that, that'd be really helpful.
so they do not have to strain themselves. Being a carer means I care for my family like any other child would, but with much more awareness and compassion. It is something that my friends would not really take into consideration on an average day. For example, helping my family member put on shoes or socks so they do not have to strain themselves, or thinking about how they are doing when I am at school. Being a young carer is something I show off with pride, as it shows I am just as careful, independent and loving as any other would be. Young carers helps me to have a boost of confidence, knowing there is always someone to talk to that will understand me. Young carers put together events that help me relax, and so I do not have to worry as much as I usually do. The Young Carers team are people I know I can confide in when I need help or when something is on my mind that I do not want to share with my family because I think it may upset them on how I'm feeling. Overall, Young Carers helps me to be the best I can possibly be and help me gain skills that I can use in my day-to-day life.
Does that conclude the presentation, Councillor Wheeler?
Yeah, thank you, Chair. I mean, again, just listen to Eva there. It's really hard sometimes to put yourself in that situation if you're not being there forward and listening to Eva about what she's doing there and still going to school and trying to be, in her words, sort of normal with her friends and also and perhaps friends and people not understanding what she's going through. So it's really important what we're doing to make sure we're giving Eva and all our young carers that support they need so they can obviously provide the caring that they want to do and are doing to give the caring, but also still leave their lives and grow up as they should do as well. So as normal life as they can. So it's really important, again, why we've made an all-age carer strategy. So, and where members of the committee have got the presentation or slides in front of them, we're happy to answer any questions you have, Chairman.
Yeah, so if the officers have nothing further to add, I'll throw it open to the meeting then. Who have we got? Yeah, Councillor Derry.
Yes, thanks very much indeed. Katie, I've had the pleasure of listening to this on a number of occasions and the stories therein, and it's an incredibly important piece of work, as is the Joint Strategic Needs Assessment for it. In terms of caring itself, it's a variable feast because it's not a uniform challenge that is similar to every carer across the way. Every challenge is different to individuals. Some people actually look after more than one person. They care for more than one person. As you said, you look after two people. And therefore that in itself comes with a challenge. The hours vary for people. Whether they work or not varies for people, and the opportunities that they've got to put into that varies, and particularly children. As you said, there are some people get up before school and go and feed a pony, and other people get up and have to put the shoes and socks on under their parents. So it's when you look at life like that, it's quite a demanding thing. When I was reading the Joint Strategic Needs Assessment, etc., and you were looking at what carers themselves felt were the disparities, there clearly are a degree of inequalities, that if you're a rich carer, you can afford things that a poor carer can't. They highlighted in particular that access to aids to help them with things within the house, access to be able to have, say, a recliner chair if somebody's got really swollen ankles, etc., access to remote technology so they can look at their phone and see how is granny or granddad doing when they're out at work, and they can look in and check if they're still moving around, motion sensors, etc., etc. So one of the single areas that caused the greatest disparity was the access to the things that made caring easier, in particular the remote technology, in particular the aids, etc., and anything that makes life better for those who can't afford it, etc. How do we equalise the burden of being a carer in a way that diminishes those type of inequalities?
Thank you. That's all right. Bring Casey first. I'll come back up as well. Okay.
Thank you. The first stage of that is continuing to raise the profile of carers and enabling people to recognise themselves as carers. Many people don't. And we've done a lot of profile raising work in schools, GP surgeries, private sector organisations, Boots, etc., and voluntary sector organisations, so that when we are then become aware, or people become aware that they're carers, they can start to find the information that they need to support them. And some of that will then lead to access to grants, access to a carer's assessment if they need it, equipment, etc. Some of it is about linking with others to understand how to do certain things. But what we've also done is a lot of awareness raising with the workforce. So we have continued to think about a strengths-based approach to supporting people. You'll see in the stats that our carers hub, Young Carers Service and Engagement and Promotion Service, has been really good in terms of giving information earlier. So what we see on the graph, I'm a commissioner, I love a graph, is that we're seeing more people that are getting the support that they need earlier, and some of that will be connecting through to support to help you with your bills and some of that management, etc. And then we're not seeing as many people needing to come through for a full carers assessment, and that's a really good indicator of getting the right information and some of the right support. So you don't always need to come to the council. It's about connecting up some of those things that are out there for you. So we are starting to see indicators that are showing us that the way that the Carers Hub and some of the services that we've put into place and co-produced are having the effect that we wanted to see. In terms of stepping up some of that support and making life easier for carers, particularly carers that are doing over 50 hours a week, for example, you touched on equipment and things like technology. For the people that do come for a carers assessment, some of the support that we might suggest is technology, and that is to really help. So we've got lots of examples of how we're using technology. We've got over 1,000 carers supported in the last year with technology, and quite a percentage of those were assessed at immediate risk of carer breakdown. Nearly 90%, 89% said that it had significantly reduced carer stress. And so some of that technology can be things like supporting medicine management, fall sensors, 24-hour monitoring service. You can link that with door sensors, etc. GPS trackers on pendants can really help with some of the anxiety, etc. That comes. So there are a whole range of things. In terms of also carers, we know that one of the themes is that to support carers, we need to make sure that respite is really flexible. We've done a lot of support around making the respite flexible. So you can have an overnight break, it can be access to day services, personal assistance, shared services. Some people just want an hour or 2 hours so that they can go to the dentist or get their hair cut, etc. So, and working around when people work as well. So we have changed the way that the respite service works. But then we had a bit of a theme from some carers that said, it's great that I've now got respite, but actually I can't afford to do anything. So we've also got a carefree breaks scheme to link people to free breaks and holidays. This is a national scheme with a range of hotels. We've got a local scheme with either free or reduced access to local gyms. And we've been using some of our public health comp funding to fund some of that too. And we've also got a carers wellbeing fund, so the carers fund have that and can enable access for anything that supports physical or mental health support for carers.
Thank you.
Thank you, Chair. Just to follow that, there's an extraordinary offer that's there, and you only know about it if you need to know about it, which is one of those things, and it's often nice for people to understand how much is going on in the background, because we presented 80,000, there's a huge volume of work going on in the background. Is it accessed by a golden number single access telephone, or is there a single access brand identified site that any new person in the morning could go on and tick in and click into boxes and follow it through? What's the first prompt that people would have? Is it a website? Is it a number? What is it?
That's what I completely agree with. I mean, bringing Kate in the moment to what the detail, but I think what's completely right in terms of the message about we've got to go out there and actually ensure people know that there's help there for them, because I think some people don't understand they are carers. They think, oh, well, it's actually my other family member is the main carer, I'm just helping, but I don't count, or what I'm doing doesn't count as caring, it's because it's my job as a family member, etc. So that's really important. I mean, that's, reading through it, and we talk about the impact part of the covering report, from point 24 downwards, in terms of the work we are doing, going out there through the Carers Hub and engaging with colleagues such as GPs, to actually understand where that need is and to actually say, help is here if you want it. I think that's really key to do, so people know. And the huge increase we've seen is actually really welcome, because that shows there's people being out there without the support, thinking they didn't qualify, they didn't know about it. So what we're doing by going out there shows me it's working. Just bring Kate, if that's okay, just talk about the Carers Hub in a bit more detail.
Thank you. Yes, so part of the raft of profile raising that we've been doing with the workforce, with a range of organisations, has been to make sure that people know about the Carers Hub. We want to link people as a first port of call to the Carers Hub with all of that information, support, etc., as that earlier place to go, and some of that coordinated support for people that need it. But what we've also done is we've developed a local carers quality mark that we're now trying to get as many organisations in Nottinghamshire to go for as we can, because that's even within an individual organisation, thinking about all those good standards of carers might need more flexibility to attend medical appointments for the person that they care for. They may need a range of things, and for organisations to understand that being really important. So we're starting to see some local organisations, including Boots, getting the carers quality mark. The council is currently underway, getting all of the evidence in place to go for that quality mark too.
Can I finish, Chair, by just saying, if you haven't read the Joint Strategic Needs Assessment, a fantastic document, I would recommend it to anybody. Thank you.
Thank you very much, Councillor Doddy, and thank you for the answering Councillor Doddy's question, Ms. Moore. Councillor Dare.
Just a few questions, Chairman. Integrated services, integration between the council and the NHS. How does that work, and where do they gel? You've talked a lot about what the council is doing between the county and the city, but the NHS has got quite a lot of caring in it, and I think the two should be very closely integrated. And also, you've talked a lot about the ladies involved and not the males involved. So, could we have a brief on that, please?
Of course, Council, it's a really important point. It was right saying how we are working with people, but how we are, and that's one really key, that the whole co-production in terms of not just work our carers with all the bodies is really important. So rather than me telling you how well it's going, so I can bring Sarah to actually tell you a few things here, because it might tell you something different, but it's important to bring in to talk about how you think it's going to be your side. Is that right, Sarah?
Thank you. Yeah, so I work for Nottinghamshire Integrated Care Board, and I think one of the real pluses around this strategy is it was developed so NHS working with both the local authorities, and we all jointly invest in the service as well. So I think we all recognise the importance of carers and the need to support. So we've worked together to develop the strategy and now to commission the services. But I think very practically, we recognise that actually GP practices are a first port of call for an awful lot of people. And some people won't recognise that they are a carer, but actually they may present to the GP either with the person they're caring for or for their own health and well-being. So actually it is possible, and Councillor Dodd will probably be able to tell me more than I know about this, but actually, GPs will log on the system that somebody is a carer, so that they can then signpost them to the Carers Hub. They recognise that that person in their own right will have additional needs. I think the other work we're doing is that quality mark that Katie spoke about. So Sherwood Forest Hospital, so one of our main acute hospitals, is actually working, or has got accredited actually for that quality mark, so recognises within their own workforce that need to identify carers. But a lot of the work is working with GPs, with our Nottinghamshire Healthcare Trust as our sort of big provider of mental health and community services. So that's really, we've got an integrated commissioning approach, but also around provision. We are working with our main providers, recognising that carers touch so many parts of the system. So actually we need to make sure all parts of the system recognise people's carers' role.
Yes, seek clarification, Councillor Dudley.
Just a quick one, as you mentioned, in GP surgeries, every GP surgery has a carers champion, a person specifically appointed, a carers board up on the wall, and somebody who interacts directly with carers to identify them, and they're all, as you rightly say, flagged. The importance of flagging them up is that if I'm doing a letter in the morning to a specialist, Chair, I will deliberately mention that this person is a carer for this person with these needs, and allow that clinician that's seen them to prioritise that in whatever way they see fit. So we do use it in a very positive way.
For that clarification, Councillor Donny, and thank you, Ms Fleming. Councillor Dare, have you a supplementary?
Yeah, you didn't mention about how males are brought into the caring situation, because it seems to be, you know, more focused on the female population than the male population. That's one thing. How is that working? And the other thing you were just talking about a little bit earlier, we were talking about technologies and all the rest of it, and assistance and all the rest of it. Where does the Red Cross fit into that?
Yep, so I'll read Casey first, let's go Councillor, and I'll come back in at the end. Thank you.
So a number of points there. The Red Cross are a partnership when we're looking at equipment in the community and getting equipment into people's homes. And again, we've got a system-wide integrated community equipment loan service that works together, hosted by the Red Cross. So it's a fantastic partnership. In terms of support to carers, it is all carers. Yeah, and I know, Pam, did you want to come in? We can share my microphone.
That's all right. I was just going to answer you. You're correct in your assumption that there are more female identified carers. They're usually self-identified than males, but the services don't discriminate on the basis of sex, and it's encouraging both males and females to come forward to self-identify. You can identify as a couple when you're caring, and you get services on both the basis. My husband and myself are both carers, and we both get care assessments on that basis. So two of us will get the care assessments when we ask for them, when they're due on a yearly basis. So there's no discrimination. It's not one per household, and then only for the female of the house. Carers groups are also open to both males and females, and they do have carers groups that are out of working hours that would allow the typical male who's working during the day to attend as well. So hopefully we can cater for males as well, but we don't have separate males and females groups. So and I attend the Broxton carers groups, and we do have a lot of males attending those groups as well, and they're during the day. So hopefully we don't discriminate on the basis of sex, and we're welcoming throughout, but there is no discrimination on the basis of sex in the carers groups. Thank you.
Thank you for that explanation.
No, I mean, again, Pam's hitting that absolutely on the head. I think just to give that assurance, Councillor, to every council or residents, that we absolutely want to give support to everyone. Doesn't matter your gender, doesn't matter your age. You know, that support is there. Yes, we know we might have to do some more targeted work with some certain people, whether it be males, whether it be young people, to actually make sure they understand the support is there for them. I mean, that's what's really key. I know that some people don't, but from my earlier point, but absolutely that assurance that we want to work with everyone to make sure that the support's there, no matter who you are. Thank you.
Thank you, Councillor Wheeler. Councillor Henshaw.
Thanks, Chair. I mean, sometimes words are inadequate to express situations. I'd just like to say a big thank you to all carers who dedicate themselves to supporting people. I know in saying that there may be meaningless words, but I really feel that we should acknowledge and celebrate what you do. It's unbelievable in many instances, and has been outlined today. But in relation to the report on page 16, there's point 8 when it mentions that the 2021 census shows that nationally there are 5 million unpaid carers, which is a reduction in the number since 2011. Yet further down, the percentage of the population carrying out the tasks in Nottinghamshire is 10% higher than the England average. So is there a mismatch somewhere? Do we actually know what the figure is in relation to Nottinghamshire?
Thank you, Councillor. I completely echo your points about thanking all our carers out there. I mean, as I'll bring in case the moment, I suppose one thing I would say is because we are actively going out there as a council trying to work with people and say, your carer, we want to know that, whereas I don't know if that's the case in every council. I imagine it isn't. So figures may look a bit higher, not because we are really trying to make sure those figures are accurate, because for me it's as many that come forward as possible, great, because it means we can give them the care and support they need. But I'll bring Katie, is there anything else you want to add, Katie?
Thank you. Sorry, I don't think I fully understood the question, but I will bring my colleague Anna in, who actually wrote most of the recent JSNA, so we've got the really up-to-date figures.
If I want to clarify what I said, because it's my poor use of the English language, you didn't understand what I meant. To be clear, in Nottinghamshire, that's what I'm sort of thinking about. Do we know if the number of unpaid carers or those undertaking unpaid care tasks has risen and fallen since 2011? That's easier for me. Thank you. Thank you.
Yeah. As with the national average, our numbers have gone down slightly. So we think part of that may possibly be due to the pandemic as well. So obviously the census data is reliant upon people self-identifying, and lots of carers picked up caring as a new role during the pandemic and probably didn't realise that's what they were doing. So if you're getting your shopping for your neighbour, are you aware you're a carer? So those 80,000 that are reported, they're self-reported, we probably have more than that. So we're probably even higher than that, but we are reliant upon people self-identifying. And obviously as we go out, as Councillor said, as we go out more and more and identify more and more carers, those numbers will go up because people become aware that they are carers. So yeah, we sort of do follow that national trend in terms of that downward motion.
Thank you for that reply, and thank you, Councillor Henshaw. So, Councillor Martin.
Yeah, thank you, Chair. I think it's fantastic that the Joint Strategic Needs Assessment has recognised the strategy and we're implementing it. And as Pam quite rightly highlighted, COVID exacerbated the actual position that we were in before. There's a few things I'd like to ask. One of my main focus, I'm really glad as well that the respite care is being, the offer of respite care is being broadened out, because that's one of the things that carers would self-sacrifice anything to look after the people they're looking after, because most of them, like Pam, are family members. You know, my own brother looks after his 2 grandchildren, and they're the same. So, from Pam's point of view, the strategy, I'd like to know what you're hoping to improve. You know, for what you expect to get from it, from an improved strategy. And my other focus would be on particularly focused around younger carers, because although there's only 1,200 of them, how many of them have, I know it states in there that we've seen 500, you know, the figures in there, but have we got to all of them? Because they're probably the most difficult section of carers that we don't see until it's potentially too late, because a lot of the reporting there goes through GP practices and it's latent. So you know, how are we? How are we ensuring that we make sure that we get through to that young group, because they are, you know, in a crucial stage of their lives, burdened with other responsibilities that they would just take on anyway as a child. You know, so they're to me one of the more important groups. Obviously, the other group who are important as well is older carers who have been looking after children who are sometimes, I say children, they're adults, they're probably in the 40s. You know, how do we ensure succession planning is being taken into consideration by all these individuals? Because sometimes things happen just like that, and you know, that's another area that I would want to focus on from your strategy.
Thank you, Councillor Martin. If you'll bring Rachel first to talk about how identifying with young carers, then bring Pam after that, that's okay. So, Rachel, okay.
Thank you. Hello everyone. My name is Rachel Miller. I'm Service Director for Commissioning and Resources in Children's. So yeah, absolutely, you're absolutely right. And this is something that we've known for some time, that young carers are an under-identified area for the population. Thankfully, you've noted within the presentation we've talked about an increase. We've had a threefold increase in the number of young carers that our young carers services supporting in the last 6 months. So what we're seeing there is that the service and the work that they're doing to raise the profile of what it means to be a young carer is working. We're seeing between 30 and 40 new young carers come forward every month. So we are actually chipping away at that total that we think that we need to get to in terms of working with all young carers. The young carers service that we've commissioned, and it's a significantly expanded offer, included within that is a lot of outreach work with schools. So as well as GPs, they're going out to schools to support schools to be able to identify when they have a young person who's a young carer and what that means for them, and how the school can support them, as well as making that onward referral so they can be identified. So that I think you've seen in the slides, there's about 110 schools have already had some outreach from our teams, and what we're targeting in the following year, one of the identified areas for improvement is colleges and universities as well. So reaching that sort of 16 to 24 age bracket as well. There was one more thing I wanted to mention. It's popped out of my head. I do apologise. So I hope that gives you some reassurance in terms of that. I know what it was. So the other thing that we've got is across adult social care and children's social care is an identified set of young carer champions. So that means that when an adult comes into contact with adult social care because they have got a need, that the social worker and the commissioning staff that are working with that adult will be looking for and knowing that if there's a child involved, they might be identified as a young carer. Similarly, within children's social care, looking for those young people that we're working with, early help, working on a child in need or a child protection plan, that our social workers and our family support staff would know what a young carer is and would know what to do if they identify. So we're sort of doing all of that work to seek to increase identification.
Councillor Taylor would like to come in. Councillor Wheeler. Councillor Taylor.
Thank you. It's just to pick up on, obviously Rachel's explained the work that's going on, but it's picking up on that notion of identifying them, David. I mean, you said we've only got this many. We clearly know there are a lot more young carers out there. And Councillor Doddy commented much earlier on about people recognising that they're carers or not. And I can think of two personal local examples. One was a family of 4 children, so mum and dad, a full nuclear family. Mum had terminal illness, so dad was a carer, except he wasn't, because the impact of that illness as mum came to the end of her life was the lived experience of the children, who were perhaps not directly caring for mum, but who were involved. The dynamics of their daily living was so different because of what was going on in the household. That was at the time before this strategy was developed. And the other one is a young person who was living with an elderly parent, so it was just a one-parent family, and that parent died unexpectedly. So that was a young person whose, again, the dynamic of their life was a happy, sound life. They didn't even realise that they were a carer simply because their parent was elderly until one day he wasn't there. So they're 2 constituency-based examples I've got. So I think what's absolutely crucial is improving the recognition and improving the support, helping people to understand that they are carers. You can probably tell from my voice that that's probably all I need to say on this one.
Thank you, Councillor Taylor. Councillor Wheeler.
No, thank you, Dr. Tracy. So, can I bring Pam? That's okay, just answer the point.
Hi, lots of those things that you were talking about, Councillor Martin, are actually covered in the I and we statements in the carer strategy. One of those things was life after caring. Those are a vital component of, because it's about preparing for that time when you do stop caring, for whatever reason, and it might be suddenly that you stop caring. It might be graduated response where you're loved one goes into a care home or goes into, in my case, my daughter's preparing for supported living, so that my care role won't be as active as she goes into that. It will diminish. So it's about preparing for that time. And you're still a carer because you'll still have caring responsibilities, but you won't be actively caring and getting up in the night as I do. So it's about developing that support, and that's one of the components that we are looking at in the strategy, to develop those services, because sometimes there's that feeling of bereftness as you fall off the cliff edge. It could be bereavement, it could be they've gone into a care home, or it could be that they're still very much alive and out in the community and thriving, but you're suddenly no longer being active carers. So it's about supporting those carers in that instance. It's about looking, at the strategy. We looked at those things that were most important to carers, and tried to identify those things. And that's actually one of those things that we are actively working on in year 1 or year 2 now, going forward. So we will develop that further this year.
Yeah, so the only reason I bring that up, Pam, is because you quite rightly recognise that people's life becomes consumed by looking after those people, and when changes occur to the carer, that's when it affects the cared. You know what I mean? And that's succession plan. I'm hoping that we're trying on an individual case by case basis to sort of continuously monitor that. It's very difficult because there are so many elements and components that can change both people's lives. I've got residents who've got children who are in the 50s in long-term care, and children who are only under 10. You know, because I'm from Ashfield, obviously, it's a higher area, but the change is not just one-sided; it can be both. But the impact is great on both sides.
Well, we do have the emergency care planning as well for the both. That's through the hubs, so that we will have, for example, you run over by a bus. You've got various scenarios. You're in out of hospital that day, but you need somebody to care for them short term. You're in and out in a week. What happens then? You're in and out, unfortunately, to the morgue. So it's a longer term. But we have got that in place. We need to get that much more well known. But that is now set up with the hub, that they will undertake those details as part of the assessment. They will keep those records, so the emergency services can get hold of those and be able to assess that plan. So you've already got that plan. So that's on the system. So you've got people that you can ring short term. We will have the carers groups that will kick in with those carers who aren't actively caring but are still carers, if you see what I mean. So that you can still support carers, but they're not saying I'm still actively caring. So that because carers groups, you want them to specifically meet those needs. So we're going to work with the hub service to actively develop those specific carers groups. So that's what we will be doing in the strategy group this year.
Do we still use the Not Help Yourself as a medium for delivering the knowledge of the facilities available?
Yes, we do. That's one thing, absolutely. And we can as well. I think it's worth saying we're not in the strategy. It's the silver bullet. We're there. We've done. We can just and not talk about it. Well, it's been 1 year in, and show the progress we made. We're going to keep going and keep making sure we're working with Pam and all our carers out there to make sure we keep identifying as many carers as possible, and we're giving that whole wrap-round care. Because things Pam's described, there's some scenarios which you may not think about straight away, but when it's actually explained about them with lived experience, that's the key to co-production. We go, actually, no, did we think about that? No, let's make sure there's something in place. So there are more young carers to identify, there's more carers to identify. And as I said before, we don't know how many there are till we get to all of them. That makes sense, because there'll be some people who don't recognise. There's also things around culture. There are some people, certain cultures, who don't think they're caring, they think it's their responsibility. I know that friends of myself. So it's about just making sure we're getting out there as much as possible, which we will keep doing, and giving the support. So got my assurance, and I think that whole team and that myself, Tom, will keep be working with this going forwards to make sure we we're not just saying great, we've done 1 year, it's fantastic. This is about making sure all going forwards that we keep working just as hard. Thank you.
Thank you, Councillor Wheeler. Do you have anything else, anybody else to bring in on that, or have you concluded? Thank you. So, Councillor Pringle.
Thank you, Chair. Firstly, I think it's important to recognise Pam and her brief story today. First and foremost, I think it's very brave, Pam, delivering your experience, as brief as it has been. And also, I think we need to recognise Ellie from the video. The most shocking thing in that, 50 quid, Reg. The most shocking thing from that video is that Ellie was in, sorry, fill it, 100 quid. The fact that Ellie was actually in a school uniform, that was the most shocking part of that video from where I'm standing. Rachel mentioned 30 to 40 recognised cases coming forward weekly. Is that from the 50% that aren't registered now, or is that 30 to 40 over and above the 50% that aren't recognised? Because we've got 50%. I'd like to know where we go on that 50% at some point. And Katie, you mentioned talking about the board in general and the lack of not being able to cover all aspects of community life from all different communities. Have we got plans to include, or are there already inclusions for those communities to be represented on the board? Thank you, Chair.
Thank you.
Yeah, thank you, Chair. Going Rachel first.
Yeah, can confirm that those 30 to 40 a month are brand new children and young people that we didn't previously know were identifying as a carer. So, yeah.
Thank you. Yes, so work this year, there have been some grants through the Carers Hub to support groups to reach underrepresented voices, to raise profile. There are some particular focus groups, for example, a deaf community carers group, also a black carers group supporting people with cancer. We want to continue that kind of work, but we also want to continue being very deliberate in our general profile raising. So all of those places, particularly GP surgeries, making sure that that conversation with your doctor, conversations in school, are making sure that we are identifying carers from all groups, including those underrepresented voices that we're currently not hearing from. So yes, very deliberate priority in year 2, and that was one of the that was a priority this year, but a co-produced priority that continues into the next year.
Okay, we'll move on then. Thank you very much.
Have a supplementary, Chairman, please.
Yes, Mike.
Thank you, Chair. I'll only ask one of my Vice Chair. Katie. No, actually Rachel. So the schools that we're talking about, I'm a governor at 2 schools who are absolutely stretched to their limits with the provision of SEND and disabilities on the pupils that are in there. Are we comfortable and confident that we are approaching with the easiest way possible for reporting from these schools? Because typically the caring scenario has a knock-on effect in the future for these young carers.
Thank you. Yeah, absolutely an issue that we recognise in terms of the breadth of what schools are dealing with at the moment. But as Katie has covered, the access into the Young Carers Service is it also, that single point of access, relatively small amount of information that needs to be provided, at which point they pick up and can do a triage assessment and start to plug that young person into whatever support they need, as well as being part of things like young people's panels. Yeah, so they've got like a young person's forum opportunity to feed in their own ideas about the service and get all the support they need. Of course, what we do also need schools to be aware of and recognise their young carer role, in particular how it impacts on them in school. So the idea of, I've got a maths exam this morning, but I'm worried about mum because I've not been able to get a breakfast because I had to get here early, you know, and schools recognising the impact on the education, whilst perhaps the young carer service and adults and children's social care can support with the in the home issues. So yeah, I'm confident.
Thank you, Councillor Pringle. Councillor Jackson.
Excuse me. Yes, thank you, Chairman. Yes, this is an excellent report. It's very pleasing to see the progress that's been made, you know, on this strategy last year and going forward, and the amount of work that's gone into it. And to be quite honest, Councillor Pringle and Councillor Morgan probably asked the questions that have been answered what I was going to ask. And I do thank Pam and Ellie for, you know, their contribution, because knowing what's happening actually on the coalface sort of thing and down the grassroots gives a good insight of what a carer's responsibilities and what jobs they have to do. And it was Ellie, when Mike indicated, they're in school uniform, they're just off to school and this and that and the other. I just wondered what the vision there was. It's been said that, you know, we don't identify all the young carers that are out there either, but we have to remember they are young people. I mean, they've got schooling, they've got want to do what young people do, you know, for their own mental and well-being, social well-being, you know, as growing up as young people. I know they probably love their parents to death and doing it, but they do need some respite to be able to have their own little bit of life as well. Just hope sure that that's in place. And as I say, it's identifying there's a lot of children out there that we don't realise are looking after their parents. I think that's going to get a little bit worse as we go forward, as we're all living older and you know, with more complex problems. And I've got one little issue at home. One of my residents look after, where as a young man who's probably in his 40s now, he's got ADHD. He's slightly not with it and can be quite a forceful young man. But growing up in a family environment is good for him, you know, and it works a bit with his dad. But his mum and dad now are well in their 70s, and my worry is once they pass on, what's going to happen to him, because it's going to be a totally different scenario for him with being brought up and being looked after by his parents than going into an institution or something, you know, as a half-grown young man.
What's the response to that?
Yeah, thank you, Charlie. To bring Castelli first and I'll come in afterwards, is that okay? Thank you.
Yeah, thank you, Chair. Thank you, Roger. I think it's really difficult with young carers because, again, they are not a homogenous group. There are so many different demands, dynamics, the nature of their caring is so different. And it is really important that they actually get the chance to be children as well as the other pressures on them. So again, I think at the moment it comes down to identifying them. If you don't know them, you cannot help them. So at the moment we're still in, as we've said, we're a year into implementing the strategy, and the growth in numbers shows the impact of that work with schools and others to actually raise the profile. It isn't just a child in the home, it's a child in the home whose life is impacted by the dynamics of the home. So yes, completely take on board what you're saying. It isn't enough to send somebody, you know, a group of children who are carers on a trip to the ice skating rink. That doesn't deal with the pressures of caring as part of your daily life, which again is where this work and this strategy is seeking to support them through those other pressures, as well as giving them some of those joyous moments that children simply, you know, need to be able to have.
and generally, I mean, adding on to what Councillor Taylor said, so we absolutely are working with young people to understand, what's the best way we can help them. That's really key to understand, because all their needs will be different. So all our young carers who we identify, they come through and they have a My Life assessment, and they have an annual review. And internally as well, we have groups set up with our team where we work with all our staff, work together to make sure we're doing consistent practices and make sure it's good outcomes as we can across the sector. And I believe on the other point as well, Councillor Jackson, in terms of Pam talked so well about what we're trying to do to make sure that that support is in place, so people understand what will happen if they are, whether it be in hospital for a week or whether it might be for a day, or unfortunately if they obviously do pass away. So my thing would be to, with that said family, and with any families that people are aware of, to make sure that they have had those conversations with our team, to make sure there is that plan in place, so they've got that peace of mind as well, and then that's in place for people they're caring for. I think it's really important that they have that confidence. So if anyone ever has an issue with that, please raise that forward, and we'll have to make sure we take that forward to give that peace of mind for them. Okay, thank you.
Thank you, Councillor Taylor and Councillor Wheeler. If you've completed Councillor Jackson, Councillor Henshaw.
Yeah, just a quick question, Chair. Thanks for bringing me in. Like I say, it's a very interesting report, and I'm particularly interested in the report highlighted the impact of engagement at work. That's obviously just coming off Inspire as one of the members of the board there, and what they've indicated in their example that put to committee. Because a number of people mentioned this morning about carers that are actually still working. Because I think we'd all agree that it would be better. It's better for people if they can stay at work, because the benefit system isn't as good as it could be in relation to supporting them. So if you can stay in work and be a carer, it's better. I just would like to know, and I may have missed this, in relation to being a carer-friendly organisation, Councillor Wheeler, how are we working that through each department of this authority? Are we progressing? Are we already a carer-friendly organisation? Because it's all right talking about other organisations and supporting them to become good organisations that support carers. What are we actually doing as an authority in each of our departments in relation to becoming a carer-friendly organisation, or how we can enhance that? Thanks, Chair.
Yeah, thank you, Councillor Henshaw. It's a really important point. So we are working with our colleagues in HR to make sure that the council has got the carer-friendly quality mark. But I think you're right. We have to make sure, work with each department to make sure they've got those practices in place practically, because having that mark was actually me. And I know from my previous role, Deputy Cabinet for Personnel, that was really part of the culture. When I used to speak with our HR manager and with Secretary and Marge, that really was that conversation happening on a daily basis and weekly with our team. I think that's where it's important our managers are in their one-to-ones, having those honest conversations and with the staff. So I think it comes down to culture, and I think we do see that with the council now, where we've got that where people can come forward if they want to line manage, and we'll put all practice in place. I think what we do as a council in terms of our flexible working from home, etc., I think is really important. That's why we have that going forwards to help. I mean, that's really important to help people with obviously who are caring as well as our responsibility they have. So again, the point I'll make is if there are any particular departments anyone has noticed they think there's an issue with, obviously I'll have the conversation with my fellow cabinet members to see what support we can give in place. And if you've got constituents of yours who work for council and got experience again, please come forward and let me know, because if we know about it, we'll work with them. But I'm absolutely committed. I'm sure my colleagues are, and Tracy or Scott will shout at me or throw something at me if not, but we are absolutely all committed to working together to make sure that we are doing what's right by our employees and our departments, because again, we're conscious they will have responsibilities, and we've got to make sure we practice what we preach, and we absolutely want to do that. Thank you.
Okay, supplementary question. I'm sorry if I'm holding people up, but I think you're right. It's vitally important, and in relation to us as a council, how we respond to carers in our own organisations, vitally important. So, do you think then we are a carer-friendly organisation now, or we could be better? Can we do things in a more carer-friendly way as an organisation? And perhaps how we're moving forward with that. It may be something to see how, as a scrutiny committee, we could scrutinise actually how it actually is being implemented. at some future point. Thanks.
Thank you. I'll answer first, and I think we've got being men after that from officer point of view in terms of the conversations with vendor managers. I think what's important is, yes, we'd like to get the mark. Of course we do. I think that does recognise it, but that won't be just stopping there. We need to keep working. There'll be different scenarios of conflict, etc. And there's different ways that we can know to keep supporting it. What we keep finding out from people like Pam as well on our board is like different scenarios where before go. How can we make sure we implement that internally as well as going externally? So what I'd say is, even when we do get that mark, which I'm really hopeful when we get there, we won't just stop still. We'll keep working towards and going forward. So it's okay, Sharon, bring Mel just to talk a bit more from our point of view.
Thank you.
So part of the process of the quality mark is about understanding the experience of the workforce. So certainly from a sort of top-down perspective, the council has put in place policies and procedures and is active in that. The bit that we've got to do is to understand through the staff survey who's identified as a carer and get their experience. That's the piece of work that we'll need to do for the quality mark. So I mean, I wouldn't like to say that we are a caring organisation, because I think that's up to the colleagues who work for us that are carers to say that, and I think that's a bit of work that we need to do to fully understand that.
Thank you. Councillor Doddy.
Yes, thanks very much. I think all of the work emanates from having the knowledge by which to base it on, and I come back again to how fantastic the Joint Strategic Needs Assessment has been in that respect. I think, Anna, at one stage, although there was a national decrease in the actual amount of people who were identified as carers, there was an increase in the complexity of the care that they were looking after. I think that's a very important thing and makes the work that we've heard about here today so much more important. And I just wanted to say that people say going into the doctor's surgery and being identified by the GP as a carer, it never gets to me. The receptionists identify the carers, the physiotherapists, the pharmacists, all of the team make every contact count, and therefore it hardly ever comes to me. It's the carer's champion. It's everybody around that identifies this person and says they're the carer. Can we flag it up on the records? So that's how it generally tends to occur, and it's very impressive. Thanks, Chair.
Thank you, Councillor Doddy. Councillor Wheeler, does that conclude?
I think it just shows that the system works if it's people all together working together to help identify. In fact, it doesn't have to come through to every GP. The whole team is on board with that culture of helping to identify and support. So that's great. That's what we want to keep promoting and fostering. I think that's really important. We've all got to work together to make sure we get the best outcomes, and that's why we keep doing the great work with Pam and her colleagues and with all our carers as well, to understand what different ways we can keep working together and keep learning, because we're not at the stage where we know it all and never will be. So it's important we recognise that and just keep working to find new ways we can keep supporting, and that's what we do. I keep talking and keep learning. Thank you.
Thank you, Councillor Wheeler. Just ask the officers present if there's anything to light out before we move on. Thank you very much. I move the recommendations. The recommendations are at the end of this report. I'm looking, in fact, have we got a seconder?
I'll second those, Chair.
Thank you very much. The recommendations have been moved and seconded. I now ask Martin to read out any areas for further consideration that have arisen from the debate and discussion and questions and answers.
I think just one thing, Councillor Dolly mentioned the JSNA, so I think we'll get that circulated to members of the committee so they can all see that. And then with regards to when you probably want to look at it again, we'll be looking at the work programme in total during July, so I'm sure this item will come up for consideration of how and when you'd like to look at it next year.
This, can we have a show of hands, all those in favour, please? Thank you very much. Yeah, so we're in 5 minutes, so we'll break now. Pause the broadcast, please. on, Martin?
Yeah.
Right. So I think we're all back. We've had 5 minutes, so we continue. Nottingham and Nottinghamshire suicide prevention and self-harm strategy. And this is to note that suicide can be a very emotive subject, and as such, everyone needs to consider the language that is used and also be respectful when talking about suicide. The Samaritan's advice for local councillors includes advice on speaking about suicide in public. This information has been circulated to all members before the meeting. I think all members should have one of those. Thank you. So I'm now going to ask Councillor Scott Colton, the Cabinet Member for Communities and Public Health, to introduce this report.
Thank you, Chairman. Good morning, colleagues. I think it's still just morning. Firstly, my congratulations to you, Chairman, on your new appointment, and I know he's just left the room, but also my thanks to Councillor Roger Jackson for his support and challenge during his tenure of chairmanship on this committee. I present to you, Select Committee, the Nottingham and Nottinghamshire Suicide Prevention and Self-Harm Strategy for your comment and feedback. Many members present will know that mental health and suicide prevention is something very close to my heart, and over the years, as part of my own journey, I have shared my own experiences to help those suffering in silence by trying to break associated stigmas and to inspire hope that things can get better. As I've said before, mental health and suicide prevention is one of the main reasons why I got into politics. I also know that many members and officers from right across this council equally share this passion, and many indeed have shared their own personal stories. Today, I use my platform as the Cabinet Member for Communities and Public Health to lay before you the strategy, and I will take a few moments to further introduce this report. Suicide, sadly, is a major issue for society and a leading cause of many years of life lost nationally and here in Nottinghamshire. Suicide can affect anyone and has a significant, lasting and often devastating impact on individuals, families, communities and wider society. In summary, Chairman, every suicide is a tragedy. Suicide is often the end point of a complex history of risk factors and distressing events. However, suicide is preventable by working collectively towards improving population mental health and well-being, and by responding to known risk factors for suicide in the population. Therefore, suicide is everyone's business. In particular, local councils are well placed to protect good mental health and ensure that the best possible support for those with mental health difficulties through our role, firstly as a major employer and contractor, improving the environment through housing, travel, access to green spaces and community resources, supporting the best start in life strategy and provision of education, ensuring good access to quality services such as social care, and also as a system influencer through championing suicide prevention and partnership working through mechanisms such as the Health and Wellbeing Board. Part of this role, as you've alluded to in your opening remarks, Chairman, is speaking on suicide with care. Research shows that terms and phrases used when reporting suicide are important. Inappropriate or careless use of language can sensationalise or glorify a death. I would therefore encourage you all to promote and attend the range of mental health and suicide prevention training that will be made available shortly. Overall, the paper presented today identifies key opportunities for partners to shape and deliver the co-produced local strategic vision that Nottingham and Nottinghamshire will be a place where organisations and people understand what they can do to promote well-being and reduce suicide and self-harm, and that everyone affected by suicide, bereavement and self-harm will be treated with respect and have access to resources to support them and opportunities to build hope. You'll be glad to know at this point I'm going to pause and I will hand over to Dr. Safi Ahmed from the Public Health team here at the County Council. Thank you.
Thank you for that introduction, Councillor Colton. As already stated, my name is Safi. I'm a Public Health Registrar at County Council. I'd like to go over a high-level summary of the paper that's been presented to Select Committee today. on the draft Nottingham and Nottinghamshire self-harm and suicide prevention strategy. If I could first just get your attention to the screen and showcase our new branding for suicide prevention, and also just highlight really that confidential support is available 24/7 to any Nottinghamshire resident who needs it. So I just wanted to highlight this on this slide. There's a few formats to access this support. Simply, you could text the word NOTS to 85258 for that support. Next slide, thanks Martin. Councillor Carlton has helpfully already mentioned that there are more helpful terms when discussing suicide, and as a county council we acknowledge it's okay to talk about suicide, and it's more helpful to use specific phrasing and to avoid the older term commit suicide, and you in favour of that use taken his, her or their own life, or to use having ended his, her, their own life. I think this has been shared in advance, so I'll move to the next slide. Thanks, Martin. So the recommendations of the paper, just to reiterate, is to gain feedback and input today on the new draft strategy, but also to highlight the available training opportunities to the community and voluntary sector. An outline of, for the next few minutes, what I'd like to go through is a definition of the key terms around suicide before moving to the role of public health in suicide prevention. After that, it's looking at actually the voices of lived experience, which were a real asset to us developing the strategy. And I just wanted to reference those and speak a bit about the strategy as well. So mental well-being, what is mental well-being? It includes a person's emotional, psychological and social well-being. Importantly, it determines how somebody handles stress, relates to others and makes choices. But of course, mental well-being fluctuates and it can become a mental health problem if low mood, stress and anxiety persist over a longer period of time. Now, there are well-established links that link mental well-being, established mental health disorders to suicide risk. I just wanted to relay that point. Next slide, please, Martin. Thank you. And what is suicide? So the National Statistics definition of suicide includes all deaths from intentional self-harm for persons aged 10 and over. Where the deaths are caused by injury and poisoning, where the intent was undetermined, that's the age group 15 and over. As Councillor Carlton's mentioned, suicide's a major issue for society and often has a significant, lasting and devastating impact, not just on the individual, but families, communities and wider society. Next slide, please, Martin. In a couple of slides, just going over the role of public health. Now, at its simplest, there are two parallel work streams that work to reduce suicides. So improving population mental health and well-being is the first work stream, and the second is responding to known risks for suicide in the population. So it's a two-armed approach which ultimately works to reduce suicide. On the next slide, we've got a bit more detail on how that works in real terms. So the core suicide prevention activities, so just going from left to right, improving the knowledge and skills of the mental health workforce by commissioning training. That's one of the core activities. Also comms and health promotion campaigns to reduce stigma, supporting people to access the right support at the right time. Identifying risk groups is a very large one and tackling those inequalities, as well as providing evidence-based information to inform practice across the system. Next slide, thanks Martin. One of the ways that we actually identify those risk groups, and it's a recent asset from 2019, we've had the real-time suspected suicide surveillance data set, which public health are responsible for implementing and managing. So they're reported by Nottinghamshire Police and British Transport Police. This data allows us to early identify risk factors, risk groups, and importantly enables rapid partnership responses to these sad deaths. And next slide, please. In terms of the system leadership role for suicide prevention, so Nottinghamshire County Council Public Health Team work very closely with Nottingham City Public Health Team and establish partnership meetings. So, for example, the Suicide Prevention Strategic Steering Group. This reports into the health and wellbeing strategy, the Nottinghamshire plan, and the integrated care system. And one of the really important outputs of that work is developing partnership strategies and the joint strategic needs assessments. Thank you. In terms of the role of the wider council, I think this is quite important just to touch on. So we of course reference at Nottingham County Council, and nationally we have the same theme, that suicide prevention is everybody's business. So suicide prevention cuts across the work of Nottinghamshire County Council, for example, in ensuring places and communities promote good health and reduce loneliness, or by supporting good mental and emotional well-being within schools. So just a few examples of how the work of suicide prevention cuts across the County Council. The role of lived experience was incredibly important to strategy development. I've explained on the next slide a little bit about how this translates. So a core principle of the development of the new strategy was co-production. So over the last year, we've had a team of people who've either had lived experience of suicide or of suicide bereavement, and they've developed a charter very similar actually to the Cllr strategy. We saw the Cllr strategy as a gold standard when we thought about how to develop a suicide prevention strategy. So a charter has been developed from a series of I and we statements, and that was a golden thread that informed our strategy development. To make sure that engagement was really set in stone, though, we also had link persons from that charter group to somebody with lived experience of suicide bereavement who formed part of our strategy development group, just to tie them both together. Next slide, thank you. Now, these are the words on the screen from the charter development group. I'll just read them out. I think that would do the charter justice more than my own words. The Suicide Prevention Charter sets out the key values and principles which matter to individuals with lived experiences of suicidality or bereavement by suicide. The Charter recognises the value of lived experience and acknowledges that these important voices should shape and influence local suicide prevention strategy. Residents with lived experiences have shared their personal stories and use this to develop a set of I and we statements to set out clear expectations from an individual perspective and what is expected of organisations and services to meet those needs. You've hopefully seen the Suicide Prevention Charter as an appendix in your pack ahead of today. We can move on to the next slide. So the draft strategy starts off with this strategic vision that was developed together with the group of people who developed the charter. So suicide prevention is everyone's business. Nottingham and Nottinghamshire will be a place where organisations and people understand what they can do to promote well-being and reduce suicide and self-harm. Everyone affected by suicidality, suicide bereavement and self-harm will be treated with respect and have access to resources to support them and opportunities to build hope. So that's the vision that was co-produced. I think for the sake of time, we'll keep this as our final slide because we've seen the strategy as an Appendix B within your pack. But I just wanted to really emphasise the purpose of the strategy. So the purpose is, as the tagline states, suicide prevention is everybody's business. We need to secure buy-in from wider audiences. We also need to have the voices of lived experience throughout that document, and the charter is going to be the sort of endorsing the strategy from the beginning. It needs to be an inclusive format, an engaging format. As Pam said, not a strategy that sits on the shelf, and that's something that we've tried to emulate with the suicide prevention strategy. And it's come to you in draft form, and it has to the relevant boards so that we can get as much engagement as we can in developing an action plan to go with the strategy. So I think at that point I will open the floor for questions. I'm mindful of time, and we've seen the strategy as an appendix. Thank you.
Thank you. Does any other officers wish to ask a question before I open it to the floor? No? Okay. Yeah, I'll move the recommendations. I'm looking for a second.
Yep.
The recommendations are at the end of the report. Are there any speakers? Yeah, Councillor Henshaw.
Yeah, thanks, Chair. I know Councillor Garvin's got a particular interest in this, and I think that interest in helping with developing this strategy is cross group, cross party in this council, and just thanks for taking the lead on it, Scott. It's good that you've got a particular interest in that you're driving this forward, and hopefully this strategy will bear fruit. On an anecdotal sort of incident, I mentioned this to you perhaps a year and a half ago. I had an email from a divisional member that were reaching out in despair, basically saying, you're my last port of call. I need you to help me, or else I'm going to take my own life. And the previous charter that came out with the sheet on and the contact numbers for crisis teams and everybody, I relayed that by email to the person, and I didn't get any feedback, but it was better for me that I had something to follow, that I worked through, that I knew how I could react to that email, and hopefully everything worked out all right. So, this will just enhance our ability to react to people that feed through to us, and thanks very much for that.
Yes, thank you, Chairman. Thank you, Councillor Henshaw, for your kind remarks. On your second point, particularly around member training, absolutely vitally important that all members have got the relevant information there as particular as they need it. So I can remember that email exchange, absolutely. But certainly, if I had my way, I would make that training mandatory for all members. That said, going back to your opening remarks around the cross-party nature, I'm probably going to get shot by the leadership for saying this, but I think at the appropriate time, at a future full council, I think there's probably going to be a collective endeavour to put down a cross-party motion on this subject. Like I say, suicide prevention is everyone's business, irrespective of which side of the chamber we sit on in here. Those out there need our support, so I think that's something to consider for the future. Thank you.
Thank you, Councillor Carlton. Councillor Pringle.
Thank you, Chair. For those of you that don't know, Bolton's only recently had yet another suicide of a young man. So the impact across the area is high on everybody's agenda. We've had introductions out of different groups coming in, which have been really, really beneficial. There's no question about that. Really beneficial. To the few that are using them, I've got to say. I think we need to go deeper on this. First and foremost, we need to make mandatory training for all councillors. All elected members need to be on that training to understand it. So 100% backing with pushing that forward. We need to actively engage more with schools. And again, not without being political, schools are absolutely stretched. But within a short period of time, these school leavers that are leaving in end of July are going to be at work, and then in a scenario that they're going to be the adults who are then going to be affected that we're talking about here. So we have to actively engage with the schools and the Department of Education to put something in place now. Okay, we are failing in not doing that. Okay. So I think you need to drive that for us, Scott. And I know there'll be uphill challenges, but there can't be any restrictions. If somebody says, no, we can't do that, then you need to come and get on, someone come and back you up and move through the door. Because there has to be something we can do in schools to prevent this being an ever-increasing scenario. And I know we come to poverty and areas of deprivation, or we talk about drug abuse, and the increase in suicide within those areas. Yeah, but I know people that have taken their lives who are extremely well off, and so it's not restrictive, and it's all right us pointing a finger at certain areas. There has to be a full coverage of understanding at a young age. I'm not talking about sex education at 6 or whatever the child did in the house. There's some ridiculousness, but there has to be an understanding in this period at schools that they can engage, and even if it's just a note for families to be able to make somebody else aware, that's got to be first on our list, to the recognition, because I think there's no question it is the most difficult thing to diagnose, because those who are feeling that way don't always show that way and don't always open up, but the impact is horrendous. It's huge. The impact is huge when it actually happens. Thanks to Viv and Lucy for speaking previously. We have some fabulous people working here. We know that. I just want us to do more, Scott, on the younger side. I really do. We can. It's easy. Everyone here is known in their area, and we can all have a laugh and joke with everyone here. We go for a drink or we go for a walk. We'll meet people and talk. But it's what we're missing, and it's the families that see what we're missing that can give us the heads up. So I'd really like to see that pushed back if possible. Thank you, Chairman.
Thank you, Chairman, and thank you, Councillor Pringle. Firstly, I'm deeply sad to hear of the first issue that you described in your opening remarks. Also, I can't comment on individual cases. That wouldn't be right and proper. That said, on the further points you made, I absolutely agree with you. To be quite frank, like I said in my opening remarks, I've spoke oftenly enough about my own challenges, particularly from my early 20s, being at university, a relationship breakdown. I got to the point of, that was my fault. I could have been a better boyfriend. What could I have done differently? There were some financial difficulties in there as well. But equally, whilst I knew there were services, and at the time I was living in Derbyshire over in Buxton, and Boxing was you're in a crisis, you're in the fog, you can't necessarily see the trees for the wood, that you can have the relevant posters here, there and everywhere, or websites, text messaging services, but equally one of the best things that I found to help me, and I describe myself as one of the, and I hate the phrase to a degree, I was one of the lucky ones. And I'm not necessarily religious, but was actually a Catholic nun in our pastoral service at the University of Derby. It was her by saying 3 times, "Are you okay?" The first 2 times I denied. The third time was the point where I said, "No, I'm not okay." That is something that's difficult to speak about publicly, even still. But like I said, it's one of the drivers why I got into this game, if you like, to make a difference. I absolutely know there's more to do. Obviously, with schools around mental health support teams, we know we don't have universal coverage in Nottinghamshire. Obviously, there are challenges, and I equally hope, and I say this free of my political hat, that in this general election period, that nationally we can have a grown-up conversation around mental health and suicide prevention without it becoming a political football. Like I say, suicide prevention is everyone's business. It impacts our communities, our friends, our families, and every suicide is an absolute tragedy. So you have that commitment from me to as a committee that we'll keep those conversations going. And in 2 ways, and particularly if members want to speak to me or the team in confidence, they can do so.
Thank you, Councillor Carlton. Councillor Bailey.
Thank you very much, Chairman. Possibly just to echo the point, suicide prevention is everybody's business. I'd like to thank everybody for taking time to draft this statement and for the work that's been done. Particularly, I'd thank Councillor Carlton for showing some leadership on this one. And really, I think we all need to get around and definitely show our community leadership in our divisions and really work with our community to make sure that this is on top of the agenda. With respect to strategy point 1 of the ambitions, deliver training to develop a skilled workforce that feel confident and comfortable discussing the signposts of self-harm and suicide. I know we've spoken about counsellors with regard to mandatory training. I think everybody here possibly be in favour of that. I suppose my question is, in terms of other council staff and throughout the organisation, and perhaps looking at Councillor Wheeler now in his former role as Deputy Chair of Personnel. What work are we doing to help staff take part of these challenges? Obviously, I think some will receive that training, but obviously, in terms of others potentially, not as focused on this item, what are we doing to support those to make sure they're receiving the training? Thank you very much.
Go ahead.
Thank you, Chairman. It's a really good question. I think if we were to take a few steps back for a moment, we speak very openly and passionately about the communities that we represent and serve, but equally as a council, if effectively we can't necessarily look after our own, then we can't be in a fit and proper state to serve. That said, over the last year or so, we've made very good progress with rolling out mental health first aid training across the organisation. Maybe the team could add some quantity and statistics to that in a second, but equally as a determination to make sure that's not just into the county council, but equally into partners such as Via East Midlands, as an example, but equally having that deep engagement across local authorities, having the two-tier system here in Nottinghamshire, equally making sure that district and borough colleagues are deeply engaged in that as well. And I don't know if the team want to add.
Yes, thank you for your question. So one of the things that we're very keen to explore with the new strategy is working with our partners to see if Zero Suicide Alliance can be mandatory training across the system. So that's a really short national training online that you can complete in 20 minutes, and we'd really like that to be a sort of baseline across the whole of our system, really sort of embedding that suicide prevention is everybody's business. So that's one thing we're very keen to explore. The other thing that we commission through public health with our partners in the City Council is suicide prevention and mental health training. And again, that's open to the whole workforce, anyone working or volunteering across Nottingham City or Nottinghamshire. We have very, very good uptake of that training. And I think colleagues in local authorities take up some of the highest number of places for the training as well. So we're getting very, very good engagement on that and feedback. And then the final thing I'd just mention is the work that will be progressing around Make Every Contact Count training, which again, that will be available across the whole system and will include focus on mental health and wellbeing as well. Would anybody like that?
Thank you, Ms Jones. Right, thank you very much. Councillor Dudley.
Yes, thanks very much. I'd just like to start again by talking about the origin of strategies, which again comes from the Joint Strategic Needs Assessments. And I have Dr. Safia Ahmed's 70 pages of huge detailed information here. Following on from 2016 needs assessment, this is a joint strategic needs assessment for Nottingham and Nottinghamshire, and of course takes into account the post-COVID period and the increased risk factors and everything, and shows the importance of refreshing joint strategic needs because our world changes every day. I think in particular this then led to a strategy, and a strategy presented through the Health and Wellbeing Board led to a workshop. So this is an ongoing, living implementation, in the fact that you yourself presented that workshop to us, I think only last week. We had a mother there giving a real life experience about how her daughter had taken her own life and what impact that had happened to her and what her life had become afterwards, and how she shared that experience with people. And we asked people to take account of the recommendations and what could they bring back to their organisation in order to implement the recommendations as was put forward. So these are real documents creating real strategies which are being implemented in real life towards workshops, and I think that's the most important thing in terms of that they're not just exercises. A few of the things that were quite interesting, and one of them was for the first time when we looked at suicide, we actually put a total figure of 8% on the number of suicides which are directly attributable to online content. And I think in years gone past we've never actually attributed a figure to that before, but I feel as time goes on that will become an increasingly important area. We note as well that 2/3 of the people
are not in contact with any care services or health services or GPs at the time they take their own life. 2/3 of them, which makes the strategy so much more important that we have people out there who've got all the training, be it compulsory or otherwise, to be mental health champions, first aid champions in the workplace and the organisations in which they exist, because that's how you're going to pick it up. It's not going to be picked up, waiting 3 weeks to see a GP. It's going to be picked up in organisations through education, through strategy, etc. I very much welcome the presentation here today, and I can say it's making a real impact in terms of the fact that we are bringing it through workshops, etc. And we'll bring that back to the Health and Wellbeing Board. Thank you, Chair.
Thank you for that, Councillor Denny. Wants to comment? Councillor Carlton.
Yeah, thank you, Chairman. I thank Councillor Doddy for his remarks. I haven't necessarily got anything else to add, but I don't know if Safi wanted to add more.
Thank you, Councillor Doddy. Yes, we acknowledge that online harms and online safety is a really important and emerging issue. So that's something that we will be looking at over the coming year and prioritising with our strategy. Looking at advice for schools, advice for parents and advice for children themselves, and that's on Not Alone website at the moment. And the other thing to note is that the Tackling Emerging Threats to Children team offers schools safeguarding training which focuses on children and young people and online harms, and there's a lot of interest and demand for that training as well. Thank you.
Thank you. Councillor Martin.
Yeah, thank you, Chair. It's great to see this in the Joint Strategic Needs Assessment, definitely. My focus would be on people will get the right support at the right time and the right place. How are we going to robustly provide that? Because obviously one of the things is homelessness is quite a high factor in it when relationships dissolve and break down. So are we working with our district partners to provide accommodation for such people? Because every single time I've had a case in this bracket, it's usually single white males between 20 and 55, the highest group, who end up, when the wheels fall off, the doctor's appointment is just not enough. So how are we going to support these people, and how do we communicate to the general public to get that help? Because that's another, because you're like a fish floundering on the beach when it comes to it. You know, when you try to get help, you ring all these organisations and you don't seem to get anywhere unless it's driven by the person who is in that position, and that's not possible because it's like a vortex. So how do we improve the support network, robustly to make a difference? Thank you.
Yeah, thank you, Councillor Martin, for your comments and questions. I think to answer in sort of a nutshell, that the original starting point would be that training, the understanding, empowering our communities to spot the signs, have that more sympathetic approach. I know within different generations, when we speak about the use of language as an example where the phrase committed suicide is still used, obviously with new thinking and understanding based on that co-produced approach, that still gives the connotations of when dying by suicide was a criminal offence. So I think that's a really useful starting point. Part of, I think, some of the ongoing conversation, and also with Councillor Doddy's leadership, I think the Health and Wellbeing Board, particularly on sort of that deep dive around mental health and suicide prevention and homelessness. I know from my chairmanship of the Drug and Alcohol Partnership for Nottinghamshire that a lot of work has been done about getting those into treatment, also understanding for those that have a mental health issue, what is driving that, what is behind that. It may be a substance use addiction. In that sense, which one do you treat first? So that's one of the proudest moments within that partnership, was creating a single pathway for those with a substance use issue and a mental health issue as well. That's not to say that there are extensive challenges out there in the system at the moment. I'm not going to go into too many details, but obviously they're very well publicised, particularly around Nottinghamshire Health trust. That said, I certainly know, going back to the substance issues, that very good work is still being done around Change, Grow, Live over at Sherwood Oaks as an example. But I certainly think, like I say, a health and wellbeing board, I think may be an opportunity to have that deep dive on that single issue around homelessness.
Councillor Colton. Councillor Henshaw.
Yeah, thanks, Chair. I mean, if scrutiny is going to mean anything, it's not just a system where somebody brings a report to us and then we agree with all the recommendations. And after deliberation and listening to the officers and to members in relation to the recommendations, I feel that we could add an additional recommendation to the agenda and say that we as a committee feel that mental health and awareness training is such an important issue and such an important topic that we're trying to address, that training should be mandatory for councillors. And whether or not that means we have to amend the constitution to add it, but mandatory training is not unknown for councillors. I mean, if you're on planning committee, you have to do statutory training before you can sit on the planning committee. And is planning more important than people taking their own lives? So I would suggest that we put an additional recommendation that we look at making mental health training for members mandatory. Going back to mandatory training, if you're on a district council, if you're on governance and standards, district and borough councils tend to make that training mandatory, same as with when they're on licensing committee. So mandatory training is not unknown in local government, and I think it would be a valuable addition to our report or the recommendations that would enhance our view and our desire to make this an important topic. Thanks, Chair.
Just comment to Councillor Colton.
Yeah, briefly, Chairman. Thank you, Councillor Henshaw. It's not necessarily for me here to sit here and direct the select committee, but in more broadly terms, I absolutely endorse everything you've just said about mandatory training, and I would encourage committee to consider that.
But not here today because we don't have any obligation or additions to these recommendations. I appreciate that suicide is a matter of life and death, but I'm not sure we ought to be recommending that we make that obligatory to all councillors. Thank you very much, Cap. That's the conclusion. I've no more speakers.
Yeah, I mean, thanks for that comment. But does that mean then, if I've moved that we have that recommendation, we'll put it to the vote, and then committee can decide? Yeah. I mean,
is there a seconder for that particular proposal? Yeah, we've got a seconder from Councillor Fielding.
I guess I can't write something on off the top of my head, but obviously, basically, we'll get it put in the minutes. What you're voting on is that adult social care committee members believe that suicide training for members should be mandatory. Is that okay? We can check it with you to get sure we've got that exactly right.
So we ought to put that to the vote then, since we've got a proposer, we've got a seconder. All those in favour of that particular suggestion? We've got 3, 4. All those against? So we've got 4. You're against? Yeah. So
can we just argue? Because I miss it. So can we have for this 4 people 4 first?
4. All those for the recommendation. 4.
Chair. Chair, were you happy for me to do a roll call vote?
Yeah.
Just for clarity's sake.
Please.
Okay. So just give me 1 moment. Councillor Adair.
He's left meeting.
Councillor Bailey.
For.
Councillor Carr has given apologies. Councillor Doddy. Councillor Fielding. Councillor Henshaw.
For.
Councillor Carey has given apologies. Councillor Jackson. Against. And Councillor Martin.
For.
Councillor Ogle.
Against.
Councillor Owen.
Against.
And Councillor Pringle.
For.
So it's 5-5. The casting vote is against.
I have 5-4. So it's 5-4 and 4 and 4 against.
So the casting vote equals this.
It's not a tie.
Okay.
So
we make that recommendation.
So the recommendation is, correct me, Martin, that members believe that the suicide awareness training should be mandatory.
Thank you very much.
And that is carried.
Is that clear? After that? Thank you very much. So is there any further areas of consideration that have arisen from this discussion? Martin?
I think it's quite clear, but I'll just reaffirm. I think obviously heard that. I think member training, obviously that was covered in more detail. I think the other big thing that members kind of like talked about that they was the focus on the work with schools and young people. So thinking about how that can be incorporated into, I think not just the strategy, but the action plan that will put the strategy into place. I think that was the thing that really came out of the meeting, and also consideration about. I think members kind of agreed. About how the training is delivered for like council staff. So I'd definitely like to see consideration in that of how that's developed in the actual strategy and the action plan.
Very much, Martin. So we've got the recommendations. So all those in favour? Yeah. So that's carried. To item 8, adult social care and public health performance risks and financial position, Q4 2023-24. I ask Councillor Jonathan Wheeler, Cabinet Member for Adult Social Care, and Councillor Scott Carlton, Cabinet Member for Communities and Public Health, to introduce the report. Scott's leaving.
Yeah, thank you, Chairman. I'm just going to introduce on behalf of myself and Councillor Carlton, and we'll both have to come back for questions at the end. So, obviously, I'm conscious of time, so I could sit here for an hour and talk about some of the highlights from our performance so far, and obviously talk about the areas we still want to keep improving on. I think for me, the one key thing I want to really talk about is our local accounts, because I think that's a really key area, especially after talking about our first item today about working co-production and with our various teams. So, really glad to see Dean and Marion who've joined us today. They're our co-chairs of our voice group, which is obviously a fantastic co-production group of that we have in place who have done such a fantastic work producing this document. It's making sure that we can work with our carers and people to make sure what we're doing around social care is right and that what we are priorities going forward. So thank you very much for Marion Dean for coming on today and being here. So I'll hand over to Mel at this point, and myself and Councillor Carlton come back with any questions at the end, if that's okay, Chairman.
Please.
Hello, committee. So I'm going to invite Councillor Carton and Councillor Wheeler to pull out some aspects of the report later on about the performance. And this is our regular report that we bring to committee, where it gives you an opportunity to scrutinise our performance, both from a public health outcomes framework and adult social care outcomes framework perspective. So we have a written report that you've seen in front of you, which draws upon examples of our performance and a slide deck. But as Councillor Wheeler said, before we come to the sort of the more routine performance reporting, we'd like to focus on the adult social care local account. So Councillor Barney presented this to Cabinet last year, and the local account is our annual report on adult social care that pulls upon our performance for the whole year and describes the priorities that we're going to focus on for the year ahead. I have Marion and Dean with me, so they are the co-chairs for me with our Making It Real forum. The Making It Real forum is the part of the department that accounts for the performance. So they hold me to account, Councillor Wheeler to account, and officers for our performance. So they're joining me today to describe how we've come about the priorities in here and what you're going to expect to see as a committee going forward for the year in terms of how we're going to report. So Marion, if you don't mind, normally we sit together, so it's a bit odd us sitting across the chamber. But Marion, can you describe to Select Committee how we've took account of people's views in the big conversation and how we've come about with selecting the priorities in the local account?
Yes, good afternoon. Yes, it's good afternoon. The local account is something that I feel incredibly proud of, and so does our group, because our voice and the voices of many people in this area have contributed to it. And it's a document that's a live document. I hope you're all going to get one because it's beautifully produced. And it's very accessible. It's accessible to not just to you, who will have quite a lot of the knowledge that is explained in here, but to people who draw upon the services as well, and to to enable people to be more aware of what work is going on and how they can represent themselves or a group and to contribute towards the ongoing work. And it is an ongoing document. It's not something that's going to gather dust. It's probably going to have to be updated in not too far distant future, which is a bit alarming because it took a lot of work to get it out in the first place. But it is a live document. It's live issues that matter most to the people that need the support of adult social care. And we have been privileged to be part of the group that have contributed to writing it. And now we're waiting to see it enacted in very, very practical ways. I'm a carer for somebody with MS. Dean has cerebral palsy, and he works with us and represents. Well, we don't really represent groups. We're our own bodies, but we have that lived experience that we bring to the issues that have been raised by many other people in the big conversation as things that affect their daily lives. And so it's something that I feel very aware of, that the accountability comes with producing this report and this document. We are making promises that we want to keep, and in order to do that, we're working very hard with the people who provide those services to make sure that the voices that we heard in the big conversation are reflected in the work that's going to be ongoing in addressing issues. We've got some priorities that matter a lot to us. One is as basic but as vital as is about equipment that we need and we use, and we need to have access to, and quick solutions to problems. behind that there's the service of the occupational therapists and the physios and the social workers who may have come and done an assessment, and so it all has to work together, and it all has to work together with the person that requires it. This document is about people, and they're at the centre, and they're the drivers of all the work that's going to go on. Another aspect of our work has been with carers. I was unfortunately unable to be a part of the first item, but the carers strategy and carers space, different groups that have become very active and a vital resource for carers. That's another of our priorities. And then a very big priority is of the nature of reviews. These are reviews with the person who's in receipt of and drawing upon the services. For too long, people have felt that the review was something that was done to them rather than done with them, and didn't adequately reflect their needs and how their life was going and what would make their life better. There's a whole raft of things in the document that affects the well-being and the independence and the quality of life that people that require support need. And again, behind that, we've worked with social workers. I currently am a part of something called Making It Happen, which is working with social workers under the auspices of the principal social worker. And that's required a lot of training for the social workers themselves, and a raising of awareness that listening is a vital part of that work, not talking at, not talking for, but listening to the people that they are working with. And Dean has been very proactive and the thorn in the side of making payments, the direct payments to people so they can manage their affairs and exercise choice. And so much work has gone on behind the scenes, and I know that's true of all the work that's been described this morning, to make that happen. It's an ongoing piece of work. It'll go on for this year and the next year and the year after that. But principally, we are trying to change the culture where people have had things done to them rather than being able to co-produce, to contribute to policy and practice. So I just think that it needs a wider audience amongst those people who can have an influence in governance and in making sure that this work is made real. That's what our Making It Real board is about. It's holding people to account and examining the plans that they have to make sure that what people said and what is reflected in this local account is actually acted upon. And we have a superb member in our group who constantly says at the end of the meeting, I don't want to be back here next year and we're saying the same thing needs to be done. And I think that we are being more proactive and we are working really hard. We've learned that it's not all the council's fault. He says that as well now as well. It's not just people are not buying into it. We are trying to make a real difference, and we want to be able to say to the folks that came along to the big conversation or contributed to the surveys that you said this and we're doing this in order to try and meet that need. So I'm very excited about the local account. It's something that really exemplifies the fact that people have got a voice, can use it, and can see. This is the result of people using their voice and being listened to. So thanks very much for having the opportunity to contribute to this meeting.
So we're on to slide 4 now. Sorry, Martin. Dean, could you just tell Maren, do you mind switching off your mic? Yep. Dean, have you got anything to add? I think Maren's covered quite a lot of it, but can you got anything to add in terms of what you're hoping we're going to achieve and be reporting to this committee about with our adult social care performance?
Well, the local account is going to be reviewed every year. And what I want to see is progress being made across the board, and that we can move on to address other issues that will come up as time goes by. My 3 passion areas are around improving two-way communication between the authority and the people that it serves, and then going into a few more specific areas around how reviews and financial reviews, audits, etc. are carried out. And my own personal passion being a person who draws on direct payments for many years now. I think there's a lot of room for how that could be made so much better and less bureaucratic both for staff and for the people who use them. So they are my 3 or 4 priority areas. So I see the making it real form as very much like what this committee is all about, where it's about scrutiny and accountability and driving change. Thank you very much.
Thank you both, Dean and Marion. So, committee, the report that you will receive going forward. This is Q4 performance that you've got in your pack. Each quarter, the performance will be shaped to report against the local accounts from an adult social care perspective, and the stories of difference and the data will have been agreed by the Making It Real forum. So it gives you that extra level of assurance that isn't just me describing to you what's wonderful about adult social care or public health. So the report draws upon some key successes, and I know both Councillor Carter and Councillor Wheeler want to draw your attention to that, but you can see in the report we've described the progress against carers strategy. You've heard that in detail today. You've heard technology-enabled care being referenced both in the section on the carers. It's also been referenced in some of the discussions about the support we provide, and that's one of the areas that we're particularly proud of in the last quarter and will remain a priority going forward. Dean and Marion both talked about the quality of the interaction between our colleagues and people with lived experience and their families, and you'll see that reference throughout in the stories of difference. But equally, in some of the performance reports, we're talking about who's had a review, what's their experience of that, what's the quality of the service. So just draw together some of those key things. But I'm going to pass over to the Cabinet members to make any references they wish to draw.
Thank you, Chairman. I can only say 4 times, so I haven't necessarily got anything to add at this point, but happy to take questions.
And again, I'm conscious of time, but one thing I just really want to, regarding Chairman McCann, is around the employment side, because I think for me, we're going through the report, knowing that over 750 people smashed our target that we've helped get back into employment or training, something we should be really proud of as council, because it's not only the financial side of it, but the fact that that social engagement side. And I think we all know when we first got our first job or even second job, just feeling that sense of worth and the purpose, being able to go out in the day and being training work, it makes such a difference mentally to your well-being. And so people who perhaps didn't think they would be able to have that opportunity, I think it's absolutely fantastic and something we want to really keep doing. We've not set our laurels, we've got a stretch target of 800. And I think it's worth saying as well, just giving one example, I think it's in the report where there's when we were supported our fantastic Brook Farm hub, and it's managed to get a placement here in West Bridgeford. So just shows again, really fantastic about the fact that training support we can give to people to make sure that they have the same opportunities that everyone else has. I think that's really key part of our ethos that we want to foster. So that's just one of the many examples. I could go on for hours, but I'm conscious of time. So as Councillor said, happy to answer any questions. Thank you, Chairman.
Thank you for keeping it short and sweet. Have we any questions from the floor? Yeah, Councillor Pringle.
Quickly then, Chair. First of all, thanks to Marion and Dean for your comments. I think it's vital, and fair play to Melanie for pushing us forward and having that group conversation. I think it's really positive, and welcome your views from people on the ground better than me. A frustrating thing for me with regards to paper is that these, certainly from page 20 onwards, there are coloured charts. In actual fact, grey seems to be the predominant colour. That's really difficult to share on here. However, I think there's obviously issues. We talk about insufficient capacity, and I think Dean mentioned something about that, pushing that forward. Been nice to see a comparison to where we are now to where we're going to be, even if it's in a year's time, but to see that there is change and have comparison papers here. Thank you, Chair.
Thank you, Councillor Pringle. Any comment?
Yeah, thank you, Councillor. Take that way and look at how we can make sure we get that to work going forward. So thank you for that.
Yeah, so there's no more questions. So that concludes it then. Martin, is there any areas that you picked up from talks or anything that needs further?
No. I think it's just noticed about the how it's presented. I think obviously because we've printed in black and white, that the things are in colour. Perhaps this conversation would have to try and make it a bit more how it would present better in black and white.
Yeah. So we moved and seconded it, so we can now put it to the vote. All those in favour? Thank you very much. Thank you for coming to speak. Thank you. So we now move on to item 9. I'll hand it over to Martin.
So yeah, today's the last meeting of the work programme for this year. So just note that we will be doing some work, quite a lot of work about developing a new work programme during July to have that ready to take to overview in September, where everyone will have a chance to feed in to the areas of focus that you'd like to look at from September onwards. But unless there's anything that anyone would like to raise now, the work programme's just to note really.
Just to recognise the things that we spoke about today to be added onto the work programme.
As in
general, the comments that people.
Oh, about the performance. Yeah.
So you'll sort them.
Yeah.
Martin's going to sort them. Any more comments on the work programme or any suggestions? No. Right, we'll move on then. and that means we close the meeting. So please stop the recording. Thank you all for attending the meeting.